Yeah, so I'm Blair Bethwaite, and I'm Solutions Manager at NeSI. I'm also the Acting Platforms Manager at the moment. And so NeSI is the New Zealand eScience infrastructure. One of the key pieces of infrastructure that we run is high performance and supercomputing platforms for the New Zealand research sector. So that's both university and government research organisations.
Wonderful, thank you. Can you tell me a little bit about how NeSI is working to solve the COVID-19 problem?
Sure, yeah, it's certainly been an interesting year, hasn't it? So we, during New Zealand's first national lockdown from late March to mid-May, that was, we had NeSI classified as an essential service from the New Zealand government or agency perspective, so that we were able to remain operational and accessible for researchers. And that really meant that one of the key things there was being able to make sure we were had engineers able to get access to facilities to ensure continued operation of the machines. And we also put out a targeted call to the sector for anybody working on COVID-19 research.
Wonderful. Can you tell me a little bit more about the targeted program that you just mentioned, as well as any examples of projects that are leading this subject at NeSI?
Yeah. So we, I guess we were quite lightweight in our in that program. That was really just a call to let people know that we remained open for business and that we could provide sort of above and beyond support, above and beyond what people might normally be used to. We have established researchers and research groups that use the platforms quite routinely, and so one of the key things that we wanted to do was sort of quickly understand what groups might already be working in this space. And so in some cases that was a matter of knowing which research groups and which organisations were actually had their heads down and were getting tapped on the shoulder by government to provide some advice, and then getting a communications channel going with those teams so that we could explore opportunities to help them. In some cases they don't necessarily realise that they can come to our support team and ask for help with profiling or advice on optimization and those sorts of things. So we went through a few of those sort of more communication-centric iterations, trying to figure out what people across the sector were doing. We also set up a special quality of service on our scheduling systems so that we could give specific projects essentially a fast ticket through the queue where they were doing that time-sensitive work. And so some of the examples there's a couple of projects from the University of Auckland. One of those was building a contagion model to model the spread of COVID-19. So that was sort of it's a contact network type application where they're doing stochastic modelling of potential spread of the virus. And so they were providing scenario advice into government and preparing reports for cabinet as they were meeting regularly to figure out when lockdown could be lifted or when restrictions could be changed. There was another project, and that work actually is that work that I just mentioned, the contagion modelling. That's ongoing, and another project in Auckland looking at automated strategies for image processing of data such as chest X-rays and CT to identify COVID-infected patients. So it's along similar lines. There was an interesting news story I saw in the last couple of days actually, which was a machine learning application identifying asymptomatic COVID cases just from the sound of people's coughs on recorded mobile phone calls, which was it's similar application for that, although perhaps not quite as scalable. And we saw some projects set up from regional health boards in New Zealand as well, where we had some epidemiological modelling going on more locally within the community. That contagion model project that I talked about in Auckland previously, that was a nationwide strategy. So they were modelling about 5 million agents within that model.
Wonderful. Thank you for those examples. I really liked what you said about the service-centric focus that you've implemented at NeSI to really support your researchers in optimizing their code and their research. Can you touch a little bit more about how HPC has enabled and accelerated their research in this?
Yeah, so I mean, acceleration is the key term there. Definitely, time is certainly of the essence for some of these teams, and that's one of those interesting challenges because obviously we've got big resources that people can bring to bear on these problems, but at the same time, we can by spending a bit of time looking at code and doing a bit of basic profiling work, we can often speed up by multiple, single digit factors, usually quite easily, and often even better. But getting a busy research team that is trying to prepare advice to government cabinet to sort of stop and engage and help a computer scientist at NeSI understand what's happening in their code, or why they're building a graph in a particular way, is one of those challenging softer problems, and so we had to slowly push the team to keep engaging, even though they were getting knocked back, and that has paid off definitely in a couple of those instances. We were able to get a 2 or 3 factor speed up for some of those models just by reducing some of the memory usage, so that they were able to actually run more jobs in parallel. And the discovery of the community transmission of COVID in the August outbreak in Auckland, that contagion network team had to quickly launch a large number of simulations there. I mentioned before, that is it's stochastic modelling, and they're doing looking at various scenarios as well. So they sort of aim to provide statistical confidence across a number of different scenarios, so that they can give key decision makers a good picture of where things might head. And helps those decision makers also figure out where to focus on the contact tracing resources and those sorts of things as well. So their network represents close to 5 million individuals and has links to the places that they might interact, so work, school, dwellings, community. And each of those models takes sort of hours to run using large amount of memory. So just being able to pare back some of those resource requirements helps with scaling as well, and accelerates what they're able to do.
Awesome. You mentioned there about how it was important to be able to be in touch with different organisations and communities, especially when New Zealand was doing quite well compared to the rest of the world in terms of COVID-19 and the outbreaks there. And then, of course, in August we were watching from, I guess, across the pond as there was that outbreak that you mentioned in Auckland, which I think we were all kind of worried about to hope that it wouldn't be too disastrous over there in New Zealand. And you can see now, after the fact, that you've done quite well because of the ability of these networks to come together to again suppress that outbreak. And so in talking about working together, we're in a pandemic, and the sharing of knowledge and collaboration is really important, I think probably now more than ever. How has this worked to your advantage, and what are the initiatives that you're involved in to help accelerate and advance COVID-19 research on a national and a global scale?
Yeah, it's an interesting question. I guess our response nationally has certainly been coloured by the fact that we've fortunately been able to get the virus under control quite quickly. And so there's actually, there's been a few small areas of targeted funding through government, where that group that I mentioned from the University of Auckland doing the contagion modelling, they've had some funding to build a national epidemiological network. There previously was not one prior to COVID. And so that's a project that we're sort of scaling up to think about beyond COVID or post, what the next thing after COVID. But at the moment so in New Zealand, we really don't have any further major national calls going on. We continue from the NeSI side to look for anybody doing work in this space on COVID-19 or related areas so that we can give them that sort of higher level of support service and make sure that they're aware of the consulting options that are available to them, which is, it's not uncommon for researchers to just come along and use the machines and not get the value out of that consulting model that we offer, particularly where they have just used NeSI in the past and haven't been aware of that. We're aware that there's a number of international, efforts going on, coordinated in various places, but so far we haven't been involved in any of those. We'd certainly be open to doing that.
Okay, well, Blair, I think on that, those are my four main questions that I had for you. It's really great to see the work that NeSI are involved in, and this best practices newsletter brings HPC centres from around the world coming together to talk about COVID-19 and how they're working to solve this problem. So it's a global initiative, and we're all in this together. We're all trying to achieve the same thing and solve this problem as quickly and efficiently as we can. So thank you for your time. Thank you for participating on behalf of NeSI. I really appreciate it. Thank you.